Hi, this is Dr. Kaye, and today we're going to be doing a P-shot. A P-shot is also known as a Priapus shot. It is a procedure that was invented by Dr. Runnels to treat erectile dysfunction, but it's also great for male enhancement, meaning it induces the penis to get longer and thicker. It improves erection quality, it improves erection sensation. It is a great treatment for what's called venous leak, where the penis gets hard but then it starts to soften up as you're having sex. It's good for Peyronie's disease, which is scarring of the penis, and it's got no downsides. So the first thing we're going to do is get some anesthesia. So we locate the two nerves at 10 and 2 o'clock, and that's where we will be injecting some anesthetic. This is sodium bicarbonate, which takes the sting out of the lidocaine. So we add a little of that. And then this is 2% lidocaine with no epinephrine. And we'll fill up the syringe with that. Okay. Get all the air out of the syringe. Change to a smaller needle. And we're going to take some rubbing alcohol and disinfect the skin area before we do any nerve block. Little pinch. Okay. So here's a diagram of how we do the P-shot. So we usually have somewhere between 5 and 7 milliliters of platelet rich plasma. So typically we'll inject 1.5, 1.5, 1.5, 1.5, and perhaps 0.5 to 1 cc's in these 5 locations. While we're doing this, my assistant Gianna is processing the blood we drew into platelet rich plasma, so that when we've had a few minutes to get good anesthesia, we can just get the PRP and do the injection. So she's working on that right now. So what Gianna's doing now is transferring the blood from the syringe into the first of our centrifuge devices. What we'll do with this will be to put it into our centrifuge for its first spin. And the purpose of that first spin is to get all of the red blood cells out. Now she's rinsing out the last bit of blood from the tubing. This is the world's most efficient and effective PRP system. It's made by a company called Emcyte, E-M-C-Y-T-E. This system is used by all doctors who are seriously into using PRP for regenerative medicine, whether it's for injecting into joints or tendon injuries, or in our case, doing the P-shot or the O-shot. So we're just organizing everything I'm going to need to do the P-shot. We have calcium chloride, we have a new syringe, got a transfer hub, alcohol wipe, and small gauge needle, large gauge needle. So what we have now is the second spin. So in the first spin, we took out all the red blood cells and just extracted the plasma from the blood. And that plasma contained platelets. And this time around, we have spun it at a different speed and driven all the platelets to the bottom of that tube. And now Gianna is going to remove all the extra plasma that doesn't have any platelets in it. And what we're going to be left with is 7 milliliters of fluid that contains all the platelets from that large 60 cc syringe draw. And since we've gone from 60 cc's down to 6 or 7 cc's, you have a 10-fold concentration increase in platelets with this machine. That is really the best in the industry. And one thing that's really important for patients to understand is that all PRP is not the same. So you really need to find out what kind of machine they're using and how concentrated can they make the platelets. It should be at least 3 times or 5 times as concentrated as they are in the blood. Ours is 10 times as concentrated, and that's state of the art. So this is now our PRP. So we've anesthetized this patient by using a nerve block. And what I'm going to do now is mark where I'm going to be doing my injections. So I want to have the foreskin retracted so you have good anatomy. You know, where is the dorsal surface? So we're going to go here, 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 and here. So the next step is to add calcium. And why do we add calcium? Because calcium activates the platelets. It causes them to rupture and release all the different growth hormones that are inside them, and that's what stimulates the stem cells to do their repair work. If I just injected PRP without any added calcium, well, what would happen? It would just wash back into the circulation. So now I'm activating the PRP. And we'll inject about 1.5 cc's. Everything looks good. Patients didn't feel anything. And we're done. After the P-shot, you really don't have any limitations. You can have sex as you normally would. We recommend that you do not consume anything like Motrin or Advil. Those are called non-steroidal anti-inflammatory drugs. Don't take those. Don't take any type of steroid medication like prednisone. That can block the effect of the P-shot. We recommend that patients use a penis pump. I usually say this is physical therapy. Let's say you broke your arm, you need a cast, and then you need physical therapy. Well, you want your penis to inflate, you want it to be hard, you want that new PRP to regenerate the tissues in a hard, rigid shape, not curled up. So we want to make sure you're getting hard erections twice a day, and that's why we recommend a pump. We often put patients on medication as well, something like tadalafil or sildenafil, and the purpose of that is to get more blood flow into the penis and improve healing. If the patient does the pumping, takes the medication, takes certain supplements that we recommend, we commonly see an 80 to 90% success rate in our patients with that protocol.